Retinopathy of Prematurity, or ROP, is a disorder of the blood vessels of the retina. It is a potentially blinding eye disorder that primarily affects premature infants weighing about 2 3/4 pounds or less that are born before 31 weeks of gestation. The smaller a baby is at birth, the more likely that baby is to develop ROP. This disorder, which usually develops in both eyes, is one of the most common causes of visual loss in childhood and can lead to lifelong vision impairment and blindness. The blood vessels of the retina begin to develop 3 months after conception and complete their development at the time of normal birth. If an infant is born very prematurely, eye development can be disrupted. The vessels may stop growing or grow abnormally from the retina into the normally clear gel that fills the back of the eye. The vessels are fragile and can leak, causing bleeding in the eye. Scar tissue may develop and pull the retina loose from the inner surface of the eye. In severe cases, this can result in vision loss. Most of the time, ROP is not noticed by the naked eye. Thus, an eye exam is needed. However, when symptoms do arise, they typically include crossed eyes, turnout eyes, or vision impairment. Retinopathy of prematurity is most likely to develop with the occurrence of oxygen toxicity or hypoxia. Oxygen toxicity is the harmful act of inhaling molecular oxygen rather than air at particular pressures. Premature infants can be administered molecular oxygen therapy to prevent excess concentration of oxygen in the body from damaging underdeveloped tissue. Hypoxia is a condition in which part or all of the body is deprived of oxygen. In the past, routine use of excess oxygen to treat premature babies stimulated abnormal vessel growth. Currently, oxygen can be easily and accurately monitored, so this problem is rare. Some degree of retinopathy of prematurity occurs in 50% of all premature births. Of these 50%, 10% of these infants need treatment. Every year in the United States, between 1,100 and 1,500 children experience the complication of retinopathy of prematurity. The rate of ROP in moderately premature infants has decreased dramatically with better care in the neonatal intensive care unit. However, this has led to high rates of survival for very premature infants who would have had little chance of survival in the past. Since these very premature infants are at the highest risk of developing ROP, the condition may actually be becoming more common again. High-risk infants and those younger than 31 weeks gestation or born weighing fewer than 2 3/4 pounds should have retinal exams. The first exam usually should be 4 to 9 weeks after birth, depending on the baby's gestational age. Babies born at 27 weeks or later usually have their exam at 4 weeks of age. Follow-up examinations are determined based on the results of the first exam. Babies do not need another examination if the blood vessels in both retinas have completed normal development. Parents should know what follow-up eye exams are needed before the babies leave the nursery. There are 5 stages of retinopathy of prematurity. Stage 1. Mildly abnormal blood vessel growth. Many children who develop stage 1 improve with no treatment and eventually develop normal vision. Stage 2. Moderately abnormal blood vessel growth. Many children who develop stage 2 improve with no treatment and eventually develop normal vision. Stage 3. Severely abnormal blood vessel growth. The abnormal blood vessels grow towards the center of the eye instead of following their normal growth pattern along the surface of the retina. Some infants who develop stage 3 improve with no treatment and eventually develop normal vision. However, when infants have a certain degree of stage 3 and plus disease develops, treatment is considered. Plus disease means that the blood vessels of the retina have become enlarged and twisted, indicating a worsening of the disease. Treatment at this point has a good chance of preventing retinal detachment. Stage 4. Partially detached retina. Traction from the scar produced by bleeding. Abnormal vessels pull the retina away from the wall of the eye. Stage 5. Completely detached retina and the end of the disease. If the eye is left alone at this stage, the baby can have severe visual impairment and even blindness. Most babies who develop ROP have stages 1 or 2. However, in a small number of babies, ROP worsens, sometimes very rapidly. Untreated ROP threatens to destroy vision. Early treatment has been shown to improve a baby's chances for normal vision. Treatment should start within 72 hours of the eye exam. Some babies with plus disease need immediate treatment. Treatment may include cryotherapy, which is freezing to prevent the spread of abnormal blood vessels. Laser therapy may be used to prevent complications of advanced ROP. The laser therapy stops the abnormal blood vessels from growing. It can be performed in the nursery using portable equipment. To be effective, it must be done before scarring and detachment occurs. Surgery is needed if the retina detaches. Surgical procedures continue to improve, but may not result in good vision. My father was born prematurely in 1954. He was given too much oxygen at birth, thus retinopathy of prematurity occurred. He has had vision problems throughout his life. Since he can remember, he has only been able to see out of his left eye and the outside corner. He can see out of his right eye with corrective lenses. He has worn glasses since the age of 2. In 1997, he had cataract surgery in his left eye. In 2003, he had a cataract removed from his right eye and a corrective lens implanted. 4 years ago, he had a detached retina in his right eye. Laser treatment was done to fix this. He had a follow-up 6 months later. He continues to see special eye doctors every few months to watch his vision impairment.